And had written a question earlier, and he had to do with enzyme therapy. Can you tell
Mhm.
us a little bit more how you integrate enzyme therapy into your patient care?
Yeah, so I've used enzymes. Enzymes just break down food, and then it's also what your white blood cells use to go and eat things. And so those are the two uses for them. I've been using them for 17 years, so I used them before I even got into practice. My mentor of mine was Dr. Howard Loomis Jr. He was the first one to ever use enzymes in humans. He started using them in the late 60s, early 70s in Forsyth, Missouri. So now what enzymes do, enzymes, they'll break down your food. And so the ones that I use are pre-digestive enzymes. So you typically use them right before you eat your food, and they're going to help to break down food because we have three components of food. You have proteins, fats, and carbohydrates.
Mhm.
Um, Generally, what I see, I really don't see deficiency in carbohydrates. I see overconsumption of breads, grains, pastas, sugars, alcohol, candy, things like that. I don't have a lot of patients that come in and say, I'm eating so many fruits and vegetables, I just think it's messing me up. It usually just doesn't happen. And so then it gets into breaking down protein and fat. And so we look at it, and sometimes it's a problem with both. And the way I find this is through physical exam, but also the integrated urinalysis panel I run. Because if a person can't break down protein, we're typically going to see them have things like very swollen, very puffy. If you go down by the ankles and you squeeze, it won't be, if it'll feel soft in there. Um, you get into fatty acid deficiency and you start getting dry skin and hair. You start seeing problems with the female hormone system. You start seeing issues with getting pregnant, staying pregnant, protein deficiency, heavy menstrual cycle in females. I'm using the female side because I'm looking at more
Yes,
women
a bunch
here.
of girls
That's why
here.
I'm
Yeah.
using. So I'm looking at those two things. You get people that have a hard time recovering or repairing from an injury. They're, we know protein and fat are used for growth and repair. So if we're having a hard time repairing and recovering, I always ask, well, which one's not getting in? We just have to figure out which one the body's not breaking down and solve that. Is the problem with not getting enough stomach acid in there? Is the gallbladder and bile too sluggish? Are the bowels not moving? Where is this getting stuck at? And then how do we help assist this body so it can heal itself?